Hi guys, and welcome to West Virginia University's Department of Ophthalmology. I'm Jamie, the Chief Resident this year, and I just wanted to give you a little overview about our program. First off, we'd like to tell you a little bit about our crew. So we take 4 transitional year residents, and then we have 12 ophthalmology residents, and then we typically have 5 fellows per year, 2 retina, 1 cornea, 1 glaucoma, and 1 oculoplastics. Here are our current transitional year residents, Michael, Sonia, Yona, and Dina. Next are our first year ophthalmology residents, Andrew, Parker, Ami, and April. And here are our second year ophthalmology residents, Clinton, Jordan, Evan, and Alan. And lastly, we have our senior residents, Michael, myself, Jamie, Evan, and Ivan. And then we have our graduating class from last year, Drew, who went on to do a glaucoma fellowship at UT Southwestern, and then Justin, Mary, and Chris, who all decided to go into private practice. On a side note, I would like to point out that our residents are pretty awesome. We've gotten several awards from other departments within the hospital for being a fantastic consulting service, and just have had really great interactions with other departments. Next, we'll move on to our current fellows. Our glaucoma fellow is Shema. Our cornea fellow is Lena. And then our retina fellows, Philip, who's the senior retina fellow, and Christine. We did opt to take an off year for our oculoplastics fellow, but we should have one next year. Now on to our fantastic residency program team. We have Dr. Bradley Thoreau, who's our program director. And we have Lingo Lai, who is now our associate program director, and then Jacqueline, who I'm sure you all have met already. She's our fantastic program coordinator. So within our department, we actually have quite a bit of faculty. We have 28 clinical faculty members, 2 hold comprehensive clinics, 3 hold neuro-ophthalmology clinics, 2 hold medical retina clinics, 3 hold surgical retina clinics, 1 holds a uveitis clinic, 5 hold glaucoma clinics, 3 hold oculoplastics clinics, 1 does do oculopathology, 5 do pediatrics, and 4 do cornea clinics, and we have 3 optometrists. Out of all of those, we do have 11 faculty members that do cataract surgery. So our chairman for the department is Dr. Thomas Mager, who you will likely be meeting later today. So our 2 doctors that hold comprehensive clinics are Dr. Moore and Dr. Jayasalan. In our pediatric department, we have Dr. Bradford, Dr. McGuire, and Dr. Jayasalan. We have Allison Hicksenbaugh, who is an optometrist, and then we have Morgan Hodge, who is our orthoptist. In our neuro-ophthalmology department, we have Dr. Ellis, Dr. Jayasalan, and then newly added Dr. Chaudhry. And we are lucky enough to have a dedicated uveitis provider, Dr. Levy-Clark. Moving on to our cornea department, we have Dr. Ahmed Eskadari, Dr. Lai, Dr. Mager, and Dr. Toker. In our retina department, we have Dr. Goryeb, Dr. Pamiriega, and Dr. Singh, who all do surgical retina, and then our medical retina providers are Dr. Lays and Dr. Laxon. And then in our glaucoma department, we have Dr. McMillan, Dr. Palco, and Dr. Halinda, who do surgical glaucoma, and then we have faculty that do mostly research and clinic, which are Dr. Rolini and Dr. Charlton. And lastly, we have our oculoplastics department. We have Dr. Wynn and Dr. Lindberg and Dr. Thoreau. Dr. Thoreau also is our ocular pathologist as well. We also have 3 dedicated optometrists. We have Brittany Newman, Allison Hicksenbaugh, and Jordan Yulberg. We also have several PhD faculty within our department that do extensive amounts of research. One other thing to note is that our hospital has been continually growing over the past few years. So we just expanded the outpatient clinics in 2020, as well as our children's hospital just opened in September of 2022. We have been buying several hospitals across West Virginia, as well as we've got several new developments in the works, one of which is even looking at building a new Eye Institute. So now that you've been introduced to everybody, let's talk a little bit more about the residency program itself. So a typical day of residency, 7 a.m. we have morning lectures. On Wednesdays is our grand rounds day, and then Thursday we do have an independent study time during that 7 a.m. block. At 8 o'clock, then we go to our clinics, operating room, or we travel to the VA. So here we do 6-week blocks of each rotation. So first years do cornea, plastics, 2 rounds of the VA, 2 rounds of neuro-ophthalmology, peds, and consults. The second years do peds, 2 rounds of the VA, consults, 2 rounds of medical retina, surgical retina, and plastics. And then the third years do surgical retina, 2 rounds of comprehensive, 2 rounds of VA, 2 rounds of glaucoma, and cornea. So a few of those detailed things that you probably want to know. For salary, depending on your year, we range from $58,000 to $62,000 per year. For call, we take call at the main hospital and the children's hospital, which is connected directly to the main hospital. We do Q4 buddy call for the months of July and August, meaning that you have a second year with you every single time you see a patient for the first 2 months, and then we do Q4 for the rest of the year. So first years take primary call 1 day a week and then 1 weekend a month, or they can opt to split it into 2 weekends per month. Second years then take backup call, and third years then take surgical call. Covered expenses is for the first year, we buy you your BCSC series. The second year, you get an OCAP board review course paid for. This is typically the Wills course. Then third years, they pay for you to go to AAO. We also get a subscription to Opto Questions. They pay for our OCAP registration, and then the hospital gives us a meal card, and then we do get gas money to go to the VA. So some of the perks of our program is that we get to borrow lenses during residency. We don't have to pay for those. As mentioned before, we get meal cards, which is about $575 at the hospital every 6 months for the hospital cafeteria, the children's hospital cafeteria, or the Starbucks that's located in the lobby. And then we also get about $300 a month at the VA for a meal card. As residents, we do get free parking, as well as there is a free gym in the hospital that's located within the cardiovascular unit. We do get gas money to go to the VA, which is about $1,000. And then we do have weekly resident clinics where you see your own patients. This is during most of the rotations. We also get personalized embroidered scrubs through the department. We get time off, which is about 15 days per year, and holidays. And then your senior year, you do get an extra 5 days off just for interviews. I will mention that you do need to purchase your own loops to use. So here we have our recent surgical numbers from the year 2021 and from 2022. Of note, the numbers in 2022 in some areas are lower than 2021, but we did have some faculty members retire, as well as we brought in some new faculty members. And as they were just kind of getting their clinics up and running and OR up and running, we expect those numbers to now be going back up in 2023. As you can see, we do get a fair amount of cataracts, with the 2022 residents getting 274. I will say again that 2021, those numbers were a little bit affected by COVID, but for the most part, we do get a fair number of cataracts at our program. And briefly, here's just some data on our previous residents. We've taken residents from 22 different states and 33 different medical schools. Out of our 76 graduates total from our residency, 35 have gone to comprehensive, and then 41 have subspecialized, with the majority going into cornea, and then secondary we're going into retina. So while we can all tell you how great we think the program is today, I thought it might be helpful to ask a few alumni to give their reflections back on how they felt like their residency training prepared them for where they're at today. So you'll notice a lot of the overarching theme in several of their quotes are that they felt very comfortable starting out day one, and that they felt like they really had a good quality of training at WVU, as well as they really felt that their co-residents and faculty members had a really great camaraderie, and they really felt supported throughout their entire training. So let's talk a little bit about the VA. So our VA is located about 45 minutes outside of Morgantown, in which typically the whole group carpools to go to the VA. There's a first year, a second year, and a third year that go Monday through Friday. Typically there's a comprehensive clinic and subspecialty clinics depending the day of the week. Thursdays are our cataract OR days, and then we typically have one Wednesday each month that is also a cataract OR day. And then we have plastics OR days 2 to 3 times per month. Typically, a cataract OR day consists of about 8 cases. The second years do 2 of those cases, and the rest are left to the seniors. However, we get our first years involved from the get-go, and we do try and give our first year 1 full case during each rotation that they are on. Here's just some pictures from our VA experience. We do get a lot of our operating experience done at the VA, as well as the clinics are basically resident run. There's always a faculty member that comes up from WVU that's present, but mostly it's just run by residents. And then down in the bottom right hand corner, we always take that traditional picture of when you finally get your first cataract case. So we do have some practice lab areas located within the department. We have the IC surgical simulator, where we get the majority of our cataract practice in. We are getting a new version, that machine that's being delivered in November of this year. As well as we have a wet lab area that contains 4 different microscopes where we can practice doing glaucoma, cornea, or oculoplastics procedures, as well as we can do some cataracts. We also have the unique privilege of having our own LASIK and PRK laser suite on site, which allows us to do resident LASIK and PRK cases if we so choose. As well as pictured below, we have outside wet lab experiences. So one of those pictures is drug reps coming in and allowing us to test their different types of injection models. The next picture over is going and doing retrobulbar injections on cadavers. And then the last 2 were the Lions Eye Bank came in and gave us a DMEC and DSEC wet lab. One thing that I think really gets overlooked when doing resident interviews and that whole process is how important it is to have a great set of technicians and ancillary staff, especially ones that are supportive of the residents. So here at WVU, we have fantastic technicians that are extremely supportive of the residents and willing to help them out, as well as the ancillary staff, be it surgery schedulers or clinic coordinators, as well as the OR scrub nurses and circulators. They all know where everything's at and are more than happy to guide you, especially just starting out in residency. They're very, very helpful. Another perk is for any conferences that you submit and get accepted to, you do get money in order to go attend that conference. One thing that we try and do every year is go on an Alcon tour, because it's located in Huntington, West Virginia, where we drive down there as a group and we actually get a tour of the facility and find out how all of the IOLs are made. Another thing worth mentioning, especially if you're interested in doing global ophthalmology, is that Dr. Mager every year goes to Ghana for a week and performs cataract surgery. Unfortunately, the past couple years due to COVID, he's been unable to go. However, he's gone for many, many years prior to that, as well as he's planning to go again this year, and he typically takes at least 1 or 2 residents with him when he goes. We are also encouraged to attend national conferences and courses, and they do a very good job about working around our schedule to allow us to attend those if we so choose. Here are just pictured the National Forum in DC, our state West Virginia Ophthalmology Conference, as well as one of the Alcon courses that they put on that does one more in-depth surgical training. So we do work hard around here. and we make sure to take care of patients, but we also try and have a good time too. Here we've got pictures with people carpooling to the VA. We get to dress up for special occasions or holidays. We even had a therapy pony come visit us during grand rounds one time. But mostly we like to have a lot of fun after work. Here's just some different photos of either the residents getting together or residents and faculty members. We do trivia nights, axe throwing, dinners at people's houses, just a vast array of things depending on the time of the year. One of our favorite things outside of work is we have an annual boat trip where we go to Cheat Lake, and one of our fellows covers primary call for us, and so all of us residents can get on a boat for an afternoon and just hang out and have a really good time together. Another great thing that West Virginia has to offer is that we have world-class whitewater rafting. Typically we try and get some residents together to go either in the spring or the fall time, and sometimes we even get some of the faculty to join in. But probably the most popular activity to do is to go hiking. There's a nearby trail at Cooper's Rock that people like to take, but there are dozens of trails nearby that all have very pretty scenic areas or waterfalls or different things like that. So definitely is something to check out while you're here. But of course we can't forget about game day here at West Virginia. So the hospital is actually located right across the street from the football stadium, and therefore there's always a whole lot of tailgaters right outside the hospital during game day. Several different departments in the hospital do have their own designated tailgating spots even. So here's just some pictures of us residents rooting on the Mountaineers. So hopefully you've gotten to learn a little bit more about our program here at West Virginia. We again welcome you to our interview day and hope that you get all of your questions answered. We would love to have you come visit us during our open house day and actually come check Morgantown out and come see our facilities. Again, welcome to West Virginia.